Talking to patients is obviously something that we all had to learn to do, and Warwick was really good because they get you early contact with patients, so it's something you start doing actually from the second term.
The early access to patients is just amazing because it puts everything into context and it really motivates you to want to find out what lies behind.
From very early on, from like the first few weeks, we went to a community health centre and we met up with some patients. We've seen some elderly people, some paediatric patients, people with chronic conditions. That's really, really good that you're introduced so early.
Everyone was really worried about just forgetting what questions to ask because you watch a lot of other people do it in clinics, and we have lots of tutorials and they really help out, but then you don't quite realise that until you're sat in front of a patient in a real situation that all the questions go out the window.
Real people give you a genuine, honest answer. They're the people that you're going to meet when you go into practice, so they're the people, you know, they don't always give you the answer you want to hear, or it's not always the classic triad of symptoms that you learn in a textbook. It brings in the real life factors.
They don't describe things exactly as you might expect them to, and often they come with somebody else with them, or they come with their children running riot around the room, and the students have to learn to adapt to deal with kind of slightly unusual circumstances.
So I'll ask you some questions and then I'll get you to do some movements, okay? Can you tell me how many fingers I'm holding up?
3.
Okay, how about now?
4.
Looking at my face here, tell me when you can see it.
When they work with real patients, they realise that medicine is not like it is in the textbook. So a simulated patient might learn what the right symptoms are to say for a heart attack, but actually in real life it often isn't quite that easy.